Hello friend, welcome to my YouTube channel. Today we start blood supply of spinal cord. First we start arterial supply of spinal cord. Arterial supply of spinal cord derived from three longitudinal arterial channel. First is anterior spinal artery. Artery is unpaired and posterior spinal artery are paired. Anterior spinal artery and posterior spinal artery derived from the vertebral artery. Venous supply of spinal cord derived from six longitudinal channel. Two is unpaired and two is paired. Two unpaired are anteromedial vein. Vein is unpaired and posteromedian. Vein, anteromedian vein and posterior median vein are unpaired. Anterolateral vein is paired and posterolateral vein. Posterolateral vein is paired. This is complete blood supply of spinal cord. Blood supply of spinal cord derived from three longitudinal artery. Anterior spinal artery is unpaired. Posterior spinal artery, which is paired. And venous supply is from the six longitudinal vein, anteromedian vein, posteromedian vein, which is unpaired, and posterolateral vein, anterolateral vein, which is paired. Then we discuss three longitudinal vein, anterior spinal, anterior spinal artery, which runs along anterior median sulcus, and two posterior spinal artery runs along posterolateral sulcus. Pia matter covering the spinal cord has an anterior plexus called arteria vasocorona. Main blood supply of a spinal cord by the vertebral artery. It gives origin to anterior and posterior spinal artery. One of the anterior radicular branch is very large, called arteria radicularis magna. It supply arteria radicularis magna supply blood to lower two-third of the spinal cord. Venous drainage. Venous drainage from the six longitudinal channel to unpaired to paired. Two unpaired are lie in midline. Two unpaired lie in posterior median. Two unpaired lie in posterolateral or anterolateral. These connections, interconnection by a plexus of vein that form venous vasocorona. Venous vasocorona drain in radicular vein. Radicular vein into epidural or internal vertebral plexus. Into various segmental vein. This is the complete blood supply of a spinal cord. Three longitudinal channel of arteries are anterior spinal artery, posterior spinal artery are paired. Anteromedian vein and posteromedian vein are unpaired. Anterolateral vein, posterolateral vein are paired. Clinical anatomy. Thrombosis of anterior spinal artery and posterior spinal artery territory. Posterior spinal artery supply posterior 1/3. Anterior spinal artery territory supply anterior 2/3. If anterior spinal artery is affected or thrombosis in the anterior spinal artery leads to defect in cortico-spinal tract and spinothalamic tract, leading to anterior spinal artery syndrome. If thrombosis in anterior spinal artery does not affect fasciculus gracilis or fasciculus cuneatus, because the fasciculus gracilis and fasciculus cuneatus present in dorsal column of the spinal cord.